نبدأ الآن بإذن الله. All right. Hi everybody. Assalamu alaikum. Peace be upon you. شكرا جزيلا على الحضور وأهلا وسهلا بكم جميعا على قناتي على اليوتيوب ما وراء الصحة Beyond Health. Welcome everybody. Thank you all so much for joining. I hope everybody is doing great. This is my first live talk on my YouTube channel, and I hope that this is going to be the first talk of many talks that will follow after. And I hope that you will find this talk today beneficial to you, but at the same time, thought-provoking. This video will be uploaded to my channel, my Wara Saha, and I highly recommend that you subscribe and follow, please, so that you can get updates on all the new things that I post, all the new videos, and all the live talks that we will have. The video is going to be uploaded, so you can always watch it at your convenience. So thank you all so much for joining. I'm speaking in English today to accommodate any global viewers, but if you would like to get the response from me in Arabic, please state that on the chat. Please use the chat so you can give me any comments, questions. Please feel free to share your experiences, be more interactive. Feel free to drop in the chat. I'm keeping an eye on it. So thank you all so much. All right, I'm going to get started. I actually chose the topic of non-traditional career pathways in medicine because I felt like this is a topic that we don't get to hear about often or even at all, actually, in our medical schools. And I think this is kind of problematic. I don't know if it's an issue that we don't feel comfortable talking about, or we're all accustomed to believing that there's only one pathway for a doctor to be, which is the clinical pathway. But in reality, this is actually not quite accurate. And from my personal experience, and I'm going to share with you, I'm actually going to inspire you today and inform you about the diverse, impactful, and fulfilling careers that you can actually have beyond the hospital setting. So that is why I'm going to talk about non-traditional career pathways in medicine. I think this is a good news in a way that uh, you don't have to commit yourself to only one thing in your career, but at the same time, it is important to know and understand what opportunities are out there. For disclosure, this is not an invitation for you to leave medicine. This is not an invitation to not become a doctor. So please don't misinterpret this talk as such, but rather it is a talk to inform you really of the opportunities out there that you can have for your career in healthcare in general. So thank you all so much. Now, I'm going to start by actually asking, and I need you to think about this while I talk about the issue, which is the question is, would you consider leaving clinical work? So I want you to start thinking about that. So start thinking about this. Would you consider leaving clinical work? This is the question. Please drop in the chat your answer to this question. Would you consider leaving clinical work? So this is the question that I'm asking. And actually, this is a question that I remember I asked myself multiple times throughout my medical education and training as well. And I'm sure you all have been through this. So please answer this question so I can get an idea about everybody's perspective and experiences. So would you consider leaving clinical work? Thank you, Abdullah. I do not think so. All right, we have one. I love that. All right, excellent. So we're going to dive in now and talking about the pathways. So welcome everybody, and thank you all so much for joining. My name is Somaya Albhaisi. I'm a second-year GI fellow at the University of Southern California, Los Angeles, California, USA. I am a graduate of Dubai Medical College, and I have done medical residency training briefly in Sheikh Khalifa Medical City in Abu Dhabi, and then I did the internal medicine residency training in Virginia Commonwealth University, VCU, Richmond, Virginia, USA. And I actually have practiced as a hospitalist, which is basically a description of an internal medicine doctor that works only in a hospital setting. So I have already practiced and I worked as a hospitalist doctor in VCU, in the same hospital where I did residency training. Um, and I worked there for 4.5 years. Actually, I practiced as a full medical, doctor for 4.5 years after residency. And then after I did that, I actually, because of my passion for gastroenterology and hepatology in particular, I transitioned to a GI fellowship. So I'm actually now a second year fellow and I'm in the research track. So I'm actually doing research training alongside the clinical training at USC. My passion is primarily in research. I do clinical research that is focused on liver disease, in particular fatty liver disease and metabolic health. I also have a variety of interests that include innovation, digital health, and global and public health as well. So, welcome everybody, and it's such a great pleasure to be with all of you. Please feel free to also introduce yourselves to me. I would love to learn about my viewers and the people that have joined today so that hopefully we can tailor the talk to your needs as well. So, thank you all so much for joining. Now, the reason why I mentioned this topic is that I think many of us feel boxed into clinical paths. I think we're all fed this idea that we're all supposed to do one thing, which is clinical paths. But medicine actually offers a world of possibilities beyond the hospital setting. Okay. And here's the outline that I'll cover today. I'm going to talk about why non traditional paths matter. I'm going to give you real examples of career paths and options and how to start exploring them. And then at the end, I'm going to give you the time to have like a Q&A discussion. This is supposed to be brief and concise as much as I can. So please benefit from the amount of time that you're going to learn about this topic so that I'm going to take your questions, hopefully, and answer your questions in the order that I receive them. If you're watching live, drop in the chat, please, what area you'd love to explore also outside clinical medicine. So please feel free to drop in the chat the areas that you guys would like to explore outside medicine. Welcome, everybody. All right, so I'm going to talk about why exploring non-traditional paths is actually important. Many of us were never told that doctors can do other things than being doctors in the hospital. We were never told that doctors can actually innovate, can design apps, can lead public health projects, can be researchers, can even run startups or run companies. We were never told that, but this is all a part of modern medicine. That is the reality we're living in right now. And the reality is that the reason why this is becoming even more common now and more frequent, we see it around us, is that burnout and limited opportunities and the rigid systems push many doctors to rethink traditional careers. And you're all going to see this actually. So if you're all joining and you're all medical students, trainees, residents, fellows, or maybe even early career physicians yourselves, you probably are living that, or you're noticing that, or you know that. So these are very important issues that do push doctors to rethink the traditional pathways. Medicine actually gives us really valuable skills, and these skills are actually transferable, meaning you can actually take those skills that you're learning from medicine and use them in other pathways and other career opportunities. It gives you critical thinking, leadership skills, communication skills, writing skills, but even social intelligence enhancement like empathy, and even literacy of all of its aspects, including data literacy and research skills, and so many other skills you can gain from medicine that you can actually use in other pathways. The healthcare landscape is also changing. Now we are living in a world where there is the revolution of AI technology and digital health. So that is driving or opening doors for other opportunities. There is now the shift or more focus towards like global health policy, medical needs, medical minds even more. So all of these issues that have come up are all reasons why we should and we must actually explore non-traditional career pathways in healthcare. So, what are these major non-traditional career pathways? Now, you may ask me, like, okay, well, I've always been told in med school, I'm gonna study medicine, graduate, do the training, and after I'm done, I'm gonna hopefully become a doctor in the hospital. Really, this is all I've been told all these years, and that is true. I've lived that. I know that. But now, probably with the newer generations, you guys are actually seeing around differences in this kind of um, talks about pathways and things you can do after you graduate. You all are probably seeing even around you people that even drop out of medicine. This happens, or people that have gone into medicine practice for a while, but then they shifted, so they left healthcare, and probably makes you wonder. So where do I fit, or what is it really that I'm passionate about? What is it really that I can do? So I would say to that, I'm going to give you categories really of these non-traditional pathways in healthcare that you could probably think about or consider pursuing. Again, this depends on multiple factors. Okay, so it depends on your passion, your skills, but also the resources and where you live. Okay, so I'm going to give you an exhaustive list of these categories, but please keep in mind that wherever you are in this world, it kind of depends really on all of the factors that I mentioned. It depends on you, but also in the environment that you live in and the opportunities that are there around you. So I'm going to do my best to include as many of these categories as possible. And I want to hear from you all, the viewers, everyone that is listening today. Please write for me on the chat where you are and what opportunity or category of these categories actually you think you could have access to. So that's very important. The first non-traditional career pathway that is emerged, and you probably all are hearing about it, and you're probably even watching podcasts of people doing it actually, is the digital health and innovation category. So now this emergence of health tech startups, AI medicine, app development, clinical informatics, telehealth strategies, all of these are becoming even more important now, more than ever. And there's actually bigger need now for physicians or trainees like you all, or most of you, that has experience in that and would be able to translate that into practice. There's a big need, especially in the world we live in, especially in this category now with the emergence of AI and advancements in technology. From my own experience, and I'm not running a startup, but I am someone that is working in integrating AI technology and digital health tools in my own studies and practice and research. Okay. And from my own personal experience, I've discovered day by day that this is more important. These are essential skills to have. I think at some point we will, the doctors or the ones of us that don't have these skills are going to be behind and they're going to lose a lot. They're going to lose a lot of opportunities. They're going to lose a lot of time. And they're not going to do well really in the next few years only. So learning that is extremely important for us, and enhancing and improving our digital health and innovation and AI, tech, informatics, telehealth skills and knowledge is crucial for us doctors, but also for our patients. Now, for disclosure, and it's extremely important for us, I think, to recognize that at the same time, while AI advancements are painting beautiful picture of this innovation and improvement, in outcomes and service and access to healthcare, there's also concerns. There are also major concerns, of course, about AI in so many ways. The whether it is that was gonna take away jobs or reduce the amount of jobs doctors can have, or privacy ethics, and it's this dilemma of like, do we do it, do we not do it? The bottom line is, at least for us, for our generation, the generations to come, this recognition is extremely important. I think the awareness is extremely important. Using AI tech wisely is really my advice to you all. I'm not saying don't use it. I'm not saying also please dig deep into it. I'm saying let's balance both and let's do our best. So this is the first category of a non-traditional pathway, that you can be a physician that is a health tech startup founder. You can be someone that is leading AI in medicine. You can lead informatics in medicine. You can be a doctor that only provides actually telehealth services. I have seen that. You can be a doctor that does hospital work, but also provides tele services as well. So there's a variety of examples you guys can actually explore under the digital health innovation arena. Next is the research and academia. And these are non-clinical really, but it's an extremely important category of a non-traditional pathway. And under that, you can either be a physician that does both things, and this is actually what I do. So you can be a physician that is, does a clinical practice, sees patients, takes care of patients in hospital setting or in clinic. But at the same time, you can also pursue research in the second half of your time, or maybe less, or maybe more. It depends on the amount of funding and grants you have and other factors. But the research really and academia are extremely important, actually, not for just for physicians, but it's also important for our patients as well. And it spans, anything from, clinical research to translational research to implementation science. You can pursue being a physician that actually provides medical education. I know a lot of you probably are extremely passionate about educating the next generation of doctors. You can do that actually. And there are academic institutions that actually give you the protected time to do so. There are institutions that actually give you the protected time to pursue research as well. Um, Collaborations in that sense are extremely important. And you can even enhance your research skills. If you don't have a background, you can obtain degrees. And here in the US, for example, in a majority of academic institutions, they actually do cover either fully or partially your tuition fees. So if you pursue a higher degree, they would do that. And for medical education, it's the same thing. You can actually try to pursue it, and that opens doors for you. And you can do it even full time at some point as well. So this is something you can consider. You can also become eventually a full time researcher. I have seen a lot of physicians that have done that actually, that they have left practice completely and transitioned to being 100% researchers. Of course, that requires certain things, right? So that requires you to be an expert in the field with, of course, a very solid research, background, experience, and publications, and maybe a lab if you have basic science background or transition science background, and so on. And you can find that also. And I know academic institutions or academic centers are not, widely available in many countries around the world. I understand that. But when they become there, or when they are there, research is a pathway that you can take. Same thing in, let's say research NGOs. I think there are now foundations, NGO foundations that are becoming more research focused, and that could open doors for you for collaborating, but also for kind of changing your pathway if you're very passionate about research. So that is the second category, which is research and academia as a non-clinical, non-traditional pathway. The third one is health policy and advocacy. So you can do things like, for example, working with the WHO, NGOs, ministries of health in your countries. You can do policy think tanks, and you can be one of those that leads shaping health systems and pushes for equity initiatives. So you can do those things. Majority of times that requires a public health background, or at least health policy background. But I do know physicians that actually have done amazing work in health policy advocacy without having a significant background like a PhD or MPH or something like that. And they have done amazing work actually. Advocacy, it requires, I think, advocacy, I would say we need to have the courage to advocate for our communities, and we need more activism. And if this is something you're passionate about, this is something you can also do. Bottom line is health policies in general, they do require, health policy in general does require working, usually at, country level, for example. So if you see yourself someone that is leader in the community, that is leader in your own capacity, then think about that. Think about that. And actually, I do know stories of physicians that started like just, normal physicians working in the hospital, and then they went into health policy, and then they even transitioned to politics, and now we're watching them on TV. So if you feel like you can be someone like that, then this is the category for you. After that, we have the category of industry and pharma. So there are actually physicians that do leave clinical work and end up going into pharma and industry. And what I mean by that is, pharma, right? So these are the companies that actually make medicines, and they do make medications, or manufacture medicines, and they sell them. But what they can gain from the physician is the clinical background, the medical background. And there are physicians that actually join pharma that also have a background like in research, in science. They probably have PhDs and so on. So if you are someone like that, and you have like a solid research background, you do have background in safety, product design, regulatory affairs, clinical research, obviously, as I said, then that could be the category for you. And recently, this actually gained more attraction, the industry and pharma, actually. I've seen many physicians recently that completely leave academia and transition into industry, where they work in companies, actually. They work in companies. They can be consultants. They work with them as advisors. They provide research, so they can be scientists as well. So there are different types actually you can be as well when you join industry and pharma. Up next, and this is actually Al-Humam, this actually touches, by the way, to your comment. I see your comment on the chat. I'm gonna share it with everybody right now, but this actually links with the next category that I'm going to talk about, which is communication, media, and education. So that links to the fact that if you have skills related to, communication, writing, medical journalism, healthcare content creation, podcasts, being on YouTube like now, medical education startups, all of these actually can be opportunities for you that can make you a non-traditional kind of doctor. So one of the questions on the chat here is, can a doctor and a graphic designer be in the same time? Yes, absolutely. A doctor and a graphic designer in the same time, that can also be a pathway for you. Now, keep in mind that if you're talking about, being a graphic designer as like a part-time, graphic designer, part-time doctor, or full-time, it's totally up to you, your choice. But if you want to combine both, that's totally doable. With the graphic design, you can either go independent, so you can actually run your own, either, channel, company, your own service. You can have your own website, and you can provide your own services. And this way you can get paid online, and that's actually more flexible. You could totally do that. And also work as a doctor as well in the hospital setting. You can totally do that. The opportunities out there are immense. We just have to keep an open mind and follow our passion. And then finally, the clinical work. I'm going to come back to the clinical work. So even clinical work is actually changeable, and you can totally modify your clinical work. So you don't have to think that all I can do is being a doctor full time in the hospital. But you can be full-time ambulatory care. You can actually be in the clinic all the time. You can change clinical settings from inpatient to outpatient or vice versa. You can change from academia, from private, government. So there are sectors, in healthcare, academia, private, government. You can actually reduce your workload or even increase it if you want, but you can actually reduce your workload. This is usually the common scenario where you can actually request doing less clinical shifts, for example. You can actually request less or more, but this never happens, almost never happens in healthcare, but you can actually request to reduce your clinical shifts in order to give you some time to do other things. Now that comes at the expense of reducing your salary. But if you're someone that really wants to pursue something else, and you are well off and you are willing to take that risk, or the sacrifice of reducing your salary to get some more time to do other things, then feel free to do so. This is actually something you can negotiate and you can talk to your employer about as well. Now, if you're watching me from the Arab world, I would actually love to hear about what opportunities you all have seen or heard about around you. Because what I've noticed is I have seen doctors, I've heard their stories, I have watched podcasts. A lot of them are talking about their own experiences. And the ones that are, for example, from the Arab world, but they're living in the West, they talk, of course, about their experiences in the West. In the Arab world, I'm curious to know if there are, opportunities to pursue other things like that, as I mentioned. Like, for example, do you have regional innovation hubs? Do you have or organizations that do encompass, research or innovation or other opportunities that you all can think about? I would love to hear from you what you have or what you heard about or what you are aware of that I would love to know about, actually, so we can share experiences. Now, keep in mind that English proficiency and digital literacy are extremely important skills that you have to have because they will expand opportunities for you, including global ones. All right, finally, how to explore these non traditional paths. I think in order to do that, I'm going to give you a practical guidance about how to do that. First of all, start small. Like even at your level right now, let's say you're a student right now or you're a trainee, then I would start small. For example, I would engage in research. I would volunteer. I would do volunteer in the things that I like, whether it's community service or otherwise. I would join digital health competitions, programs, fellowships, hackathons, whatever it is. I would do more writing. I would write a lot. I would write blogs. I would be maybe active on social media and provide helpful, for example, medical content, let's say. I would contribute to NGOs as much as possible, build my network, and engage with people and learn from experts in the fields. Okay, so I would definitely do that. If you see yourself doing something else that is not traditional, start small, start now, and then learn new skills along the way. So, for example, research skills are crucial. Communication skills are extremely important. Learn about data analysis. This is very important. Design thinking. Coding. Coding is very important. I'm actually learning coding right now. And it has been as difficult as it is, by the way. It has actually opened my eyes to a whole world of opportunities and things that I can do that I never known that I could do as a clinician, which I highly recommend. So I'm currently learning data science, computer science, and it has been an amazing ride, actually. Yes, yeah, coding. So the coding, like for example, I'm learning right now using Python, and I'm using it to create programs, to design the figures, diagrams, illustrations. It does so many things actually that I've never known be possible outside what I have learned, in med school or even through my training. So I highly recommend. It is not easy, but there are resources, and if you are interested, please drop me a message after the video, after the live talk, and I'll be more than happy to share with you actually free resources for learning data science and coding, and you can totally use those skills to your own advantage in so many things, not just research. Then I would definitely recommend using online platforms. Make a presence of yourself, okay? So LinkedIn networking is phenomenal. Using Coursera to learn and obtain skills and, and learn new things. Take courses. I highly recommend that. EDX is another option as well. So definitely seek knowledge and seek skills in the areas that you believe that you might pursue that are different, and start from there. And the most important thing that I would advise would be to find mentors. You really need mentors that will guide you along the way, whether formally or informally. There are amazing people out there. Just honestly follow the ones that you really aspire to and look up to, but also have the courage to reach out to them. They love that. And they might be busy people that may not respond from the first or second time, but they will get back to you eventually. So be patient and be resilient and be proactive. So definitely have mentors, and not just one mentor, but you can have multiple mentors, and each mentor can serve a certain role. So that definitely went a long way for me, and I'm sure it will serve you really well as well. If you're watching live, please drop in the chat what area you'd love to explore outside clinical medicine. So that is what I want you to do now, which is if you're watching me right now, please drop in the chat what area that you'd like to explore outside clinical medicine. All right, I'll take some questions now. And while I do that, I would also like to hear from all of you about your dreams of non-clinical careers. Please share with me what you dream, what you envision yourself doing outside even medicine, outside clinical work, or maybe share with me what scares you from exploring those opportunities. I would love to hear from all of you about what you think. And for the audience that haven't joined us for the live talk, please drop comments actually for me. I will respond to them. I'm happy to share even more and answer questions. And we even have candid discussions about what these opportunities might be. And then finally, to wrap up, I want to provide you all reassurance that you're not leaving medicine really, but you're expanding it. Whether you even decide not to become a clinician eventually or not, this is not the point. The point is, whatever path you take, you are expanding healthcare even when you leave healthcare. So just keep that in mind. Um, and I encourage you to always be curious, open minded, and continue to learn. Those are all important. All right. So I think some of you is sharing their thoughts here. So I have medical economy has been mentioned. Oh, I love that. Medical economy. Medical economy. So if you're talking about like integrating, right, economic sciences into medicine, then I think this is extremely novel, highly needed. Now, in this world we live in, the business world is taking over healthcare, and it's unfortunately becoming very money driven. But if you are someone that is really thinking the other way around, which is if I want to become a physician that is actually focused on, the economics of healthcare or the finances of healthcare, because hopefully I want to improve it and I want to make it equal and free for all, because eventually this is really for us doctors, this is what we want for our patients, for ourselves too. We do want free healthcare, we do want equitable care for everybody, right? So I think if this is the goal of your pursuit, then by all means. Have I seen any medical economists? I have not yet. I have seen economists, but I have not seen medical economists. So for those of you that are thinking it or want to pursue it, you are going to be pioneers in it and leaders in the field for it. So I highly encourage you to take the lead on it. And the way you can start, we can talk about that later, or maybe you can please drop me a comment and we could talk about how to pursue that. But you have to start now, and you have to actually build skills to get you there. So you have to actually, for at least obtain, degrees in business or economy, right? Obtain the skills and the knowledge required to merge that with your, of course, medical degree, and then you can go from there. And where would you work eventually? Of course, you can work in the hospital, of course, and you can be the well sought after leader in economics and medicine, and you can even teach in universities. You can become a professor, and if you're engaged in policy, you can do that, and they can actually seek your consultations and expertise in that field. All right, how about a question about research and academia? I like it a lot, especially with coding. Yes, that will go a long way. And then when you code, you will actually become more productive and more efficient, by the way, in research. This is something that I didn't know about. I've been analyzing data the regular way, the way that takes days and days. But apparently, when you learn coding and AI, you get your eye open to another way of analyses that I've never seen before. Now, of course, you cannot sway from the traditional analyses. The statistical analysis; these are still foundational, are extremely important. But if you combine them with coding skills, it saves you so much time and it increases your productivity and efficiency. And I'm talking from experience, actually. Alrighty, a comment: having my own business, not medical related, and also plus coding is really interesting. Yes, if you want to have your own business that is not even medical related, You can totally do that. I have actually known physicians that are actually still working in the hospital. They're doctors, but actually after hours, they are business owners, and they're not healthcare businesses. They're in food industry, for example. I know a pediatrician, for example, that actually owns a Lebanese restaurant, and I think his wife is a shareholder, and she's also a doctor. So you can totally do that. Actually, you can do that within, of course, obviously the policies, regulations in your country, which of course it depends, but you can totally do that and pursue that. And you can even ask your employer in the hospital to even reduce your clinical shift counts if you really want to give more time to your business. But keep in mind that you probably jeopardizing stretching yourself thin, of course, because also running a business aside from being a doctor is very difficult. It's not impossible. There are doctors out there that have done it successfully, but this is something you can do. I want to actually point out to the fact that there are doctors out there that you all probably know about that successfully are, influencers in their own capacity. They have millions, thousands, or millions of followers on social media. They have successful podcasts. There are physicians that are also running companies, or they are, they founded their own startups, or and I'm talking healthcare related. So they're practicing physicians, but also at the same time have successfully founded their own companies as well. AI coding and 3D designing, definitely. See, we're all talking about. See, this was my point here. In the world we live in, we are noticing for sure with the uptake of AI technology that these skills are becoming more and more important. We're not taught that in med school. I mean, I'm sure you all are not. You're probably not taking classes, or you're not giving any courses or classes during med school from your med school about AI or prototype designing. I don't even think, at least for me, we were not taught coding, for example. So these are things that you actually have to seek outside the doors of the lecture halls of the medical schools. You all have to actually go out there and seek that knowledge. And with the expansion of access to data and the ease of access, no excuse for not learning those. It is so easy actually now to learn all of these things. It is so easy that it's only a matter of like your willingness, right? If you want to give it the time, if you have the time and the passion, and you want to learn all of these skills, then this is what you should do. You have to dedicate the time out of your own will to do that and pursue those things and build your foundation now and build these skills and knowledge early on, so that by the time you're done with med school, you graduate, or even after your training, you have the excellent foundation for even considering those other opportunities. Prompt engineering also can be on the list. Absolutely. Now, because AI is automating a lot of the tasks for us, doctors, and even everybody else, prompt engineering is a crucial skill that we have to have. And for those of you that don't know prompt engineering, it's in simple words, it is basically controlling AI and telling it really what to do and doing so correctly. So this is what prompt engineering is, to give it the correct orders in order to deliver for you the best possible results. Okay, so this is really what we mean by prompt engineering. And this is going to become even more and more important in the next only few months, even not just few years, because of the uptick, of course, of AI and how advanced it's become and how it's automating majority of our tasks, if not all. So prompt engineering is extremely essential. And again, there are courses out there. Even Google, by the way, has actually released free courses for those that want to learn AI. So again, no excuses. Everyone can totally access these opportunities and actually learn. But you just have to be open to learning all these things and use the time to learn those new skills and practice on your own time, even if that means you're going to have to work a lot after the hours of studying medicine. But still, these are actually equally important, if not more important, than actually reading the textbook in med school. So this is extremely important, and I think these are things that I wish I have learned when I was a med student. I'm learning it now, but it would have definitely served me better if I have learned it early on. All right. Any other questions or comments before we end the live talk today? Again, once again, I really thank everybody that has joined us today. And I wish you all the best with all the career endeavors that you might take. And I want to end this talk by saying the following, that medicine is no longer confined to hospitals. It is expanding into technology, innovation, and community impact and outreach. And we are a part of that transformation. So please remember that. We will have upcoming lives, and I invite you all to please subscribe to my channel, Beyond Health, Mawara Saha, and follow me on my social media as well. We are going to have live talks. They're going to be on a variety of topics, mostly health related. And if you have any suggestions for topics that you would love to hear about or talk about or learn about, then please leave a comment for me so that I can keep that in mind for future live talks. I want to thank you all so much for joining today, and I wish you all the best. And thank you so much, and have a wonderful day. Stay well. Assalamu alaikum wa rahmatullah. Shukran.